You saw what I posted today. So my mind is in a different place. I left my job on Monday leading global health at USAID with 900 people in DC and 1,500 staff around 65 countries and doing awesome things. And then the stop workage order has blown up really important work and hurting a really important institution in significant ways.
What's the effect?
It translates into complete work stoppages. That means a series of things that I tweeted about on PEPFAR. There are some very specific things. USAID is responsible for taking care of procuring the drugs and other supplies that are needed that are keeping 20 million people living with HIV alive. That shuts, those orders stop going out. That if you need, refills, stocking pharmacy programs across more than 25 countries immediately, that starts to happen. Second, stop order going out to implementing partners. These are NGOs all around the world. They may be local organizations, and that has 6.5 million orphans, vulnerable children with HIV, and their caregivers who have direct services that are needed for them. There's going to be an order going out to those implementing partners to stop, and certainly that payments are stopping for them. And then they have to decide how long do they go without pay, what do they do, and how does that work? Then beyond HIV, there are medicines and supplies, systems building work, staff support, aiding countries where more than 90 million children and women are getting low-cost vaccinations, prenatal care, safe childbirth, contraception, and other basic life-saving needs. One of our biggest accomplishments has been that countries that partner with the U.S. end up having greater survival for children and women because of the partnerships we create, because of the training we do, because of the capabilities we bring in, the supplies. We've demonstrated the value of being in a partnership like this. Then there's all of our eradication programs. The United States is the world leader. We have elephantiasis down to a handful of countries, and there are others on the verge of elimination. And they're entirely funded by donations largely from U.S. drug companies, supplying the drugs that make it possible, to the tune of more than $1 billion donated in drugs in this coming year. And those programs get stopped. So then all those gains you have, doesn't go away in 1 week, but 90 days of work. You have layoffs of people. You have people who are disappearing from the field. It degrades the entire line of work. Polio eradication. We have a border area for wild-type polio that's basically about 20 square miles in Pakistan and Afghanistan. Still a ways to go. And yet we're on a path that can shut it down. And you turn that off. You turn that work off. Now it's not just the U.S., but the U.S. leads that work, and you take the staff away and you start harming that investment